Great. Okay, moving on to the next session. The next session is sponsored by TCS, who are helping to rethink insurance for a digital world. They assist global insurers innovate, gain agility, and compete in a customer-driven digital world. I'm very pleased to welcome Magna Hadley from New Jersey in the US. I understand I'm not sure the exact time difference, but I understand it's very late, at least, in New Jersey. I'm very grateful to have you here. Magna is the Vice President and Global Head of Healthcare Domain Practice. Magna is and serves as the Global Healthcare Advisor. She has over 30 years of experience in defining leading and strategic business solutions and technology-enabled transformations in both the US and global markets. Her work includes extensive experience with national and regional payers, provider organisations, and pharmacy benefit managers. Magna brings a rich experience in helping healthcare businesses reinvent themselves through business and IT transformation, and has extensive experience in leading large-scale systems implementations, driving initiatives to optimise efficiencies. So welcome, Magna, and I encourage everyone to send some questions through, and don't forget to engage on the platform as well.
All right. Thank you very much, Joanna. Good afternoon, everyone. Again, thank you, Joanna, and greetings to all of my colleagues around Australia and New Zealand, and welcoming me to this event. And I want to extend my appreciation to everyone inviting Tata Consultancy Services to give a little insight regarding the changing role of healthcare insurers and what we see happening in the marketplace. So thank you again very much. For those of you who are not familiar with who Tata Consultancy Services are, we are global IT services consulting on both business solutions leader and partnering with the world's leading businesses in their transformation journeys. I think one of the unique things about Tata and who we are, and which is at the core of every employee within TCS, is, and it goes back to our unique purpose-driven. The reason for our existence is because of the community we work in and all the stakeholders in business that we service to. And that, I think, says a lot regarding all of the employees who work within TCS and how we feel about the organization and the clients we serve. One of the things we're most proud of, too, is in those commitments that we give, is that for every dollar returned to a shareholder by TCS, 47 cents goes back to the communities that we operate in, with a more purpose-driven worldwide view. And in some cases, and to give you some examples of that too, especially in the Australian, New Zealand market, one of the programs that's very close to my heart is our Go IT program. And it's where we promote young people, especially to enter into STEM education. And especially, what I feel prideful about that is young women, young girls who never sees entering into the science, the math, the IT world as a course that they should take. With our Go IT program, we promote that very much so. The other community and innovation areas that we support too, and I think it goes back to the core of who TCS is, and our strength is around application and website development, IT consulting, and technology. We partner with many of the communities, partnerships within Australia and New Zealand to bring those talents and to engage in some of the work that they're doing. Some of those are the food ladder program that you have, the marathons, which we're known for worldwide in how we promote health in running marathons throughout many countries too. The Shepherd Center for the Deaf. I think that is so keen for us for children, working with children. And especially for women, the Royal the Royal Hospital for Women Foundation. Those are just a few of the community outreach that we work with many of your organizations within the Australia market on. Now, some of the areas where Tata, we've been operating for over 30 years in the Australia and New Zealand market. One wouldn't think we have about 19,000 employees across multiple lines of business working in the region. And today, TCS, we support about 8 of the top 10 companies within Australia today. One of the things too is that we're the fastest growing in healthcare, and we're about 1.8 billion in revenue from a global level within our healthcare market. Some of the things that we're proud of and we push very highly, and I have to say I'm a big part of it too, is again also promoting women in leadership positions too. And we look very closely on how we move women across the industry, not only within TCS, but in all areas of their careers, and to ensure that they are recognized in leadership roles and are pushed more towards those roles within the organization too. Today, what I'm really going to talk about today is how the health insurance insurers, their roles are changing. Traditionally, healthcare has been about patients, insurers supplying benefits for patients, patients and physicians and hospitals. Over the years, the amount of stakeholders have expanded based on who pays for that care. And I think many of my colleagues in some of their presentations, that responsibility falls upon government. It also falls upon employers too. Now what we're seeing is that the stakeholders are expanding and many are entering the ecosystem. We are not just thinking about the physical well-being of a person, but the whole health of an individual. And some of that is best referred, and I know it's prevalent in the Australian market, about social determinants of health. It's not just about the illness, it's about the housing, it's about the food, the nutrition that one is receiving, it's about the transportation, how to get back and forth to see caregivers too. And what's driving that change? Many of the drivers has to do with the demographic shifts that we're seeing in lifestyle that's adding the cost to the industry. The population is aging, and I think Daniel, right before I spoke about the aging population too. In the United Nations estimate there would be about 1.2 billion people over the age of 60 by the year 2050. Our infrastructure for healthcare just isn't there to support that kind of services and provide the services for our age population. While healthcare systems aim to improve quality and the cost of healthcare, the major drivers for change are better access to care, quality and affordable care, seamless and frictionless experience for members, which again is a big announcement, and in many of the presentations that was put forward in this summit today is about member experience, consumer experience, the young experience, how they feel about healthcare, and are they getting the right and appropriate healthcare when needed. And then also a lot has to do with transparency and trust. Transparency and trust in the entire system too. Insurers have to change. And the way in which we're seeing our point of view and what we see for the future for insurers is that they're reshaping, insurers are going to be reshaping how healthcare is going to be looking like in the future. They're not going to be claims administrators. What it means for insurers now is reshaping themselves, being not from claims payments as an organization. They're going to be orchestrators of health, and they're in the best position to do that. Traditionally, insurance offered wellness programs for their members, and they continue to offer these programs. But what they weren't seeing is the results of those programs. They would put them out there, but they weren't seeing that the results or the members were following through on some of their programs. Their interactions with providers were around processing claims, paying for claims, authorizations for certain services. They weren't seeing the outcomes of how a provider was servicing their patients and what kind of outcomes and care and quality of those care that was given. And that is what's going to be changing in the future, and how we project the future of insurance are going to be changing. Insurers cannot do all this by themselves, and the ecosystem is key to this transformation. And insurers will play a key role in anchoring all of this in the ecosystem. So areas, for instance, and we believe that insurers are in the best position to do that. For instance, they're working with a lot of communities in where they operate in. They know the environment and the health status of those communities. They know the nutrition issues that are happening within those communities. They're connected to clinics there. They're also connected to fitness centers there too. And they have the whole ecosystem at their discretion, and they are the best to receive that data and to be able to work with those patients or the entire ecosystem to see that care, how it's delivered, when it's delivered, and it's delivered in a purposeful way with better outcomes for their patients. So they're shifting from what they used to focus as sick care to health care. And what that means is one of the biggest changes we're seeing is that, for instance, when you go to a doctor, for instance, popping a pill will cut your cholesterol, as an example. But was that doctor really treating or prescribing or looking at that patient for what may be causing those levels of cholesterol to go up? The stress that was eroding their immune system. Good healthcare, and what we see good healthcare as is that it's got to be preventative. It's got to be predictive, and it's got to be personalized. To help change, there needs to be a major push for the whole body wellness, not just treat the illness, but provide care with taking into account a full range of factors: the physical factor, your lifestyle factors, habits, both mind and body, play a big role in preventing illness and helping people with recommended changes long enough for them to see the benefits of those changes. So that's what we mean from moving from sick care, not treat the symptoms, but help improve the health, the overall health of that person. Some of the things that we're seeing that are taking place is that in the past, insurance only covered services that were performed in a hospital or various care settings. Now what we're seeing, and I believe COVID unfortunately had to be the one to drive where we're seeing enabled care being enabled in other areas, such as the adoption of telehealth and telemedicine. Many regulators, including in the US here, we have what we call the Centers of Medicare and Medicaid Services in the United States, is now allowing payments for remote care, such as video conferencing, calls, the interaction between the providers and the patients through a telehealth service. Now, I know that has always been in Australia, and that has not evolved throughout the world. But with the uptick of COVID, we're seeing more and more that telemedicine, telehealth, virtual health being reimbursed and paid for. We are seeing insurance paying for Uber transportation for taking patients to doctor's visits and treatment centers. The successful of all these digital and connected care will rely on a model called bedless hospitals, right? And it's better if we see hospitals' beds empty, which focuses on delivering care within a less high-cost setting, such as in the homes of patients, setting and engaging patients with a journey towards wellness is what we're looking for. So how that is happening is all through IoT, technology, digital advances in technology, supplying these changes and helping enabling those changes too. Moving from volume-based care reimbursements to value-based care is what's needed. And I think one of the physicians earlier in her presentation talked about that. Health insurance companies are allocating much of their revenue towards value-based care. This will require insurances for seeing the data and tools to make the right decision at the right time, measuring quality of care against outcomes, and designing reimbursement models linked to the quality of care. Every person really wants a full, healthy life, to lead a full, healthy life. Getting care that's more efficient and more focused on outcomes, rather than just a number of services they get. Focusing on value helps health systems and insurers reach beyond their typical scope. Things that used to be outside the purview becoming front and center. Doctors writing prescription for healthy foods instead of drugs or medication. Concerns on mental health and transportation. That's what we're seeing happening in the whole ecosystem and what is changing in healthcare. I'm sorry, I wasn't moving my slides. The clicker wasn't working. Sorry about that. In summary, move from exclusively managing healthcare payments and claims. What we're seeing insurance do is managing the holistic patient care management. Some of the key drivers for that, right, is technology, changing the business model, adopting new policies, infrastructure changes, info sharing of that data, moving from being reactive and more proactive and predictive when it comes to healthcare. One size does not fit all, personalizing that care to the individual. Also moving away from institution-centered and more being connected to the whole ecosystem and all the stakeholders who have the best interest of health for all of the patients that they're servicing or all of their members that they service. Empowering the consumer to engage more and more within the services they're getting, the cost of those services, understanding them, and what they can do to improve their overall health. Yes, I am. At what point did you lose me? Did you hear my? Okay, all right. So at that point, this concludes my presentation. I want everyone to please join us. There's a digital booth that TCS has set up for this conference. Many of our points of views and a lot of the data that I spoke about is in that digital booth, as well as some of the examples and solutions that we see all around artificial intelligence, digital, how it could enable and giving insights to the individual and the communities that we serve, doctors that we serve, all around that, to be more insightful on how care is delivered and to use those insights in a purposeful way in improving the health of their patients. Joanna?
Great. Thank you so much, Magna. That was really interesting. And I'm definitely going to go check out your booth. I'm very interested to hear some examples. Would you like to give just maybe, one or two examples of transformation programs that TCS has been doing, and potentially any in the Australia or New Zealand market?
A lot what we've been doing is introducing what we call now is digital, right? Many of the insurers, they lacked automation, and it doesn't have to be big transformation. It could be a small work of transformation in a particular area on a process that was very manual intensive. Another one that we're seeing is the adoption of cloud, and how cloud could bring down costs, but also provide a way in which information could be pushed out to both the consumers as well as to doctors and information. A lot of work that we're doing. And around digital insights, where data was very siloed, right? Mm-hmm. Bringing all of that data in one area, getting insights from it and pushing it out, whether to providers or all the various stakeholders in the community. Those are some of the transformation programs we've been running in Australia.
Great. And you touched on one of my favourite topics of value-based healthcare. Are you supporting clinicians in that space? Do you think they're ready, or can you help them to transition to delivering value-based care?
And yes, we are supporting both physicians, insurers, and in now my world in the US, payers, providers, as well as insurers, and all community where there's data. Value-based, we've actually built some solutions around value-based, and that we could demonstrate to many of the payers, consumers within the Australian market too.
Fantastic. Thank you so much. I think that's all we've got time for at the moment, but we're really grateful for you to join us, Magna, and I hope everyone jumps over to your virtual booth and checks it out there.
Thank you again for your time today. Thanks.
Thank you. Have a good night.
Have a good conference. Good night.